Dr. Ben Stroud. I'm from Knoxville, Tennessee. I was born and raised right here in Knoxville. I went to Farragut for high school, and then I went to UT for my undergraduate, and then I went to UT Memphis for my dental school training. After that, I joined Cornerstone in 2002, and then I went on to be trained in neuromuscular dentistry at the Las Vegas Institute of Advanced Dentistry, and I've been practicing here ever since. Cornerstone is unique. When I joined Cornerstone, I originally joined from the aspect that I was going to go somewhere where there were 4 dentists, I could gain a lot of knowledge and then go hang my own shingle and practice dentistry. What I found out is how important relationships were when I got here. And what I found was a family of men who taught me how to pray, how to be a family man, and how to be an excellent dentist. Obviously, I'm a general dentist, so luckily in a general dentistry, we get to do a little bit of everything that we want to. I treat children, I do adult dentistry, love doing cosmetics. I've had a lot of cosmetic training. To recreate somebody's smile is just a fun thing to do because you see the response afterwards, the before and afters, and they're just wowed with their smile, a new, sense of self-confidence. I had one gentleman, we fixed his teeth, and I was walking through the mall the other day, and I couldn't help but look at myself in the reflection of all the glass walking down. So I'm surprised to walk into somebody. Things like that are a lot of fun. So obviously the cosmetic parts is a joy. We do some additional stuff such as treating sleep apnea. Sleep apnea is a very important thing to get corrected. It's very devastating to people's health, and there's a lot of people suffering from it this day and age. For people that are CPAP intolerant, and I make them a sleep apnea appliance, which is a very simple appliance that simply holds the jaw forward and opens up the airway so people can breathe at night. I also treat a lot of TMJ for people that suffer with TMJ pain or migraine headaches, or for instance, if somebody had a full mouth reconstruction where all their teeth had to be crowned for some reason. We have some new technology out called T-Scan, and what it is, some computerized equipment, and we have the patient bite on a sensor, and it tells us the amount of pressure on every single tooth in their head. So we're not just relying on paper to look at by marking their teeth or asking the patient what exactly they're feeling. We can actually get that data on the computer that shows us how hard each tooth is hitting and where. And then we can make those adjustments and alleviate a lot of their symptoms that way. I have a beautiful, wonderful wife whose name is Amanda, and we have 3 wonderful children. Bowen is my oldest. He's 3 years old. He's a lot like me. Even looks a little bit like me, so I'm a little bit partial. And then there's Everett. He's a year and a half. Absolute joy to be around. Rambunctious personality, lots of fun. And then we have baby Kylie, who was just born. She is now 2 weeks old, and just very excited about having my 3 children and get to go home to them every day. So some of the technology in dentistry, we've had major advances over the past few years. That has really changed the scope of dentistry. When you can take somebody, do a CT scan of their mouth, have an implant guide made, it guides where the implant goes. You can already have the crown fabricated and ready to go in its place before you even start working on the patient. So those type of advancements in dentistry have just been tremendous. Our materials are better than they've ever been. We've moved away from the amalgams, which are the silver fillings that a lot of people used to get in their mouths. And we now go to composites, where the composite material actually bonds both sides of the tooth. We also have lasers in dentistry, and there's so many different applications for the lasers, from treating soft tissue to treating periodontal disease, crown lengthening procedures. You can even remove bone and actually prep teeth with lasers, which adds to the patient comfort experience, which has been very nice. When I was probably in the 7th grade, I went to my family dentist, who was Dr. Love, a fantastic gentleman, very good dentist. And in that moment, I decided, hey, I think I kind of like this. And from that moment on, I've always moved towards dentistry. And then had some great mentors who got me started in the RAM clinic, remote area medical, who does a lot for indigent care or people that, don't readily have access to to dentistry. So I volunteered a lot with them during college. If any of the information we've been discussing interests you at all, or if you're looking for an environment where somebody actually really cares, wants to tailor treatment to you specifically, find out more about us at www.whatasmile.com. You can search out your different doctors for a personality type you might think you link up with. And we are here to serve you and look forward to the opportunity to meet you as well. Thank you.